difference between the two of you. Now let's move to health care, where I know there is a clear difference, and that has to do with the Affordable Care Act, Obamacare, and it's a two-minute new segment, and that means 2 minutes each, and you go first, Governor Romney. You want it repealed. You want the Affordable Care Act repealed. Why?
I sure do. Well, in part, it comes again from my experience. I was in New Hampshire. A woman came to me and she said, look, I can't afford insurance for myself or my son. I met a couple in Appleton, Wisconsin, and they said, we're thinking of dropping our insurance. We can't afford it. And the number of small businesses I've gone to that are saying they're dropping insurance because they can't afford it, the cost of health care is just prohibitive. And we've got to deal with cost. And unfortunately, when you look at Obamacare, the Congressional Budget Office has said it will cost $2,500 a year more than traditional insurance. So it's adding to cost. And as a matter of fact, when the president ran for office, he said that by this year he would have brought down the cost of insurance for each family by $2,500 a family. Instead, it's gone up by that amount. So it's expensive. Expensive things hurt families. So that's one reason I don't want it. Second reason, it cuts $716 billion from Medicare to pay for it. I want to put that money back in Medicare for our seniors. Number three, it puts in place an unelected board that's going to tell people ultimately what kind of treatments they can have. I don't like that idea. Fourth, there was a survey done of small businesses across the country. It said, what's been the effect of Obamacare on your hiring plans? And 3/4 of them said it makes us less likely to hire people. I just don't know how the president could have come into office facing 23 million people out of work, rising unemployment, an economic crisis at the kitchen table, and spent his energy and passion for 2 years fighting for Obamacare instead of fighting for jobs for the American people. It has killed jobs. And the best course for health care is to do what we did in my state, craft a plan at the state level that fits the needs of the state. And then let's focus on getting the cost down for people rather than raising it with the $2,500 additional premium.
Mr. President, the argument against repeal.
Well, 4 years ago when I was running for office, I was traveling around and having those same conversations that Governor Romney talks about. And it wasn't just that small businesses were seeing costs skyrocket and they couldn't get affordable coverage even if they wanted to provide it to their employees. It wasn't just that this was the biggest driver of our federal deficit, our overall health care costs, but it was families who were worried about going bankrupt if they got sick. Millions of families all across the country. If they had a pre-existing condition, they might not be able to get coverage at all. If they did have coverage, insurance companies might impose an arbitrary limit. And so as a consequence, they're paying their premiums. Somebody gets really sick. Lo and behold, they don't have enough money to pay the bills because the insurance companies say that they've hit the limit. So we did work on this alongside working on jobs because this is part of making sure that middle-class families are secure in this country. And let me tell you exactly what Obamacare did. Number one, if you've got health insurance, it doesn't mean a government takeover. You keep your own insurance, you keep your own doctor, but it does say insurance companies can't jerk you around. They can't impose arbitrary lifetime limits. They have to let you keep your kid on your insurance plan until you're 26 years old. And it also says that you're going to have to get rebates if insurance companies are spending more on administrative costs and profits than they are on actual care. Number two, if you don't have health insurance, we're essentially setting up a group plan that allows you to benefit from group rates that are typically 18% lower than if you're out there trying to get insurance on the individual market. Now, the last point I'd make before
2 minutes is up, sir.
No, I think I had 5 seconds before you interrupted me. Was the irony is that we've seen this model work really well in Massachusetts because Governor Romney did a good thing working with Democrats in the state to set up what is essentially the identical model, and as a consequence, people are covered there. It hasn't destroyed jobs, and as a consequence, we now have a system in which we have the opportunity to start bringing down costs as opposed to just leaving millions of people out in the cold.
Your 5 seconds went away.